Madam Deputy Speaker, when I'm out in my community speaking with people, one of the top issues that comes up is around the cost of healthcare. And health in my community in Western Sydney is an extraordinarily difficult issue. We have some of the highest rates of obesity in New South Wales, which puts pressure on our local public hospital with chronic disease, and we've also got some of the highest rates of mental health issues. And I hear often from local constituents around wait times, inability to get into the hospital, into the mental health beds, and of course the inability to see a doctor that will bulk bill. And that's really been the theme of this week, is asking the Prime Minister about the truth in his claims that all an Australian needs to see a GP is their Medicare card, when we clearly know that now people need both their Medicare card and their credit card, and it is something that people are writing to me. I asked this question of the Prime Minister this week, and not only from my community, I've had emails and phone calls from right across the country saying this is true. We are really struggling in this cost of living crisis to pay our bills, to pay our electricity bills, to send our kids to school, and we're also struggling to see a doctor. This is extraordinary in this country, but it's extra extraordinary because the Prime Minister promised all you need is your Medicare card. He certainly did blunder his way through the response in question time. It was noted in my social media how terrible his answer was and how much of a lie that is now, a broken promise really to the Australian people. When we're talking about seeing a GP, it's always about the ability to be bulk billed. And the truth of the matter is, under the Coalition, bulk billing was at 88%, and it's now 11% lower under this Labor government at 77%. People from Lindsay and right across Western Sydney just can't afford these higher costs, particularly if it is a regular checkup. And as I mentioned in the outset, we have some really high rates of chronic disease in my community, so it is putting real pressure not only on individuals but on our local health system, as well as families and individuals going to the doctor. We're really concentrating as well on the impact this is having on seniors and aged pensioners who, as we know, go for a lot more checkups as they get older. And one of these people contacted me this week, a pensioner, and they weren't from my community. As I said, I'm getting letters from right across the country, and they're saying they're now paying hundreds of dollars to see their local doctor for regular procedures, which they used to pay nothing for. This is the state in which we have our primary health care right now. I've also had another person contact me saying they are paying $110 to see their GP. She gets just $40 back on Medicare. The gap fee means it's getting harder and harder for so many Australians to see the doctor right now. So people are reaching out because they've got real-life stories and real-life struggles that the government is just completely ignoring while the Prime Minister continues to wave his Medicare card around. It's a real slap in the face for people that are struggling right now to be told that everything is so wonderful and you don't need anything else but your Medicare card. But the truth and the reality is people aren't being able to get to their GP, they aren't being able to get the health care they need. And we talk about Medicare urgent care clinics. I've got one in my electorate. It was opened by a Labor member that is not from my area. I wasn't invited to that opening, but that doesn't really matter. What it's about is the local community. But I've had constituents not able to access this clinic due to short operating hours and an inability to take certain walk-ins. That's extraordinary. So under the fanfare of we're going to make things easier for people in my community, once again it seems like the Albanese Labor government's trying to hoodwink people in my community. It's just not good enough. We'll keep pressuring the Prime Minister on his claim that you only need a Medicare card, because what you need is both a Medicare card and a credit card, and Australians deserve so much better. I give the